Listen to me. I want you to sit down, put your phone on silent, and look me in the eye. Because we are talking about your money, your health, and your future. And in 2026, the rules of the game for Medicare Part D are changing in a way that could either save your retirement or, if you aren't paying attention, leave you with a financial hangover that you simply cannot afford. I know. You hear Medicare and your eyes glaze over. You think, Susie, I already signed up, I'm good to go. No, you are not. Because the government has moved the goalposts. For the first time in years, we are seeing some of the most aggressive changes to prescription drug coverage since the program began, and if you are retired or about to retire, this is the information that determines whether you stay safe and sound or end up broken and spent. Now, let's talk about the big elephant in the room, the cost of staying alive. We all know that as we get older, our medicine cabinets start looking like a small pharmacy. And for years, the donut hole, that gap in coverage where you had to pay for everything yourself, was the absolute bane of a senior's existence. Well, I have good news, but it comes with a warning. In 2026, the out-of-pocket cap for Part D is moving to $2,100. Now, stop. Think about that. In 2025, it was $2,000. It's going up. Why? Because it's tied to inflation. But here is the reality: once you spend that $2,100 on covered drugs, you are done. Your copays go to zero. Your coinsurance goes to zero. You have a ceiling on your fear. That is a major win for those of you on high-cost medications for cancer, rheumatoid arthritis, or diabetes. But, and there is always a but with Susie, isn't there? You have to understand that this cap does not include your premiums. And it does not include drugs that aren't on your plan's formulary. Are you listening? If you are taking a drug that your plan decides to drop in 2026, that money you spend out of pocket doesn't count toward your cap. You could be spending thousands and still be miles away from your safety net. This is why you cannot, under any circumstances, just let your plan auto-renew without checking the annual notice of changes that comes in the mail. If you throw that envelope in the trash, you are throwing your financial security in the trash. Let's talk about the Medicare Prescription Payment Plan. This is a big one for 2026. If you find yourself hitting the pharmacy in January and being told your bill is $600 because of a high deductible, which, by the way, is rising to a maximum of $615 this year, don't panic. You now have the option to spread those costs out over the entire year. It's like a buy now, pay later but for your health. Is it a loan? No. Are there interest charges? No. Is it a good idea? For many of you, yes. It makes your cash flow predictable. And in retirement, cash flow is king. Starting in 2026, if you opted into this in 2025, it will now automatically renew. You have to decide if that still works for you. Don't let the system decide for you. Now, I want to talk to the millions of you taking drugs like Eliquis, Jardiance, or Januvia. For the first time ever, the government has negotiated prices on 10 of the most expensive drugs. These prices go live on January 1, 2026. This is huge. We are talking about potential savings of 50% or more on these specific medications. But here is the fear: because the insurance companies are losing money on those high-priced drugs, where do you think they are going to get it back? They are going to try to raise your premiums. I'm seeing projections that Part B premiums are going up, and Part D premiums could be all over the map. I need you to be a warrior for your own wealth. When open enrollment hits, you go to Medicare.gov. You put in your drugs. You look at the total cost, not just the premium, but the premium plus the drugs. Do not be fooled by a $0 premium plan that charges you $100 for a generic pill. That is not a deal. That is a disaster. And what about those of you who haven't retired yet? You're 64, you're looking at the finish line. You need to account for these costs now. I see so many people retire thinking they'll spend $200 a month on health, and it ends up being $800. If you don't have that extra $600 in your budget, you're going to be dipping into your 401k faster than you planned, and that, my friends, is how you outlive your money. Here's your actionable takeaway, and I want you to write this down. The $2,100 cap, this is your maximum paying for covered drugs. If you hit it, you're safe. Budget for it. The $615 deductible, most plans will have this. Expect to pay this upfront in January unless you use the monthly payment plan. The negotiated 10, if you take one of the negotiated drugs, your costs should drop, but check your formulary. Just because the price dropped doesn't mean your specific plan has to make it easy for you to get. The notice of change, read it. Every word. If your premium is spiking more than 10%, you shop around. You have the power. I want you to be afraid of being ignorant, but I want you to be empowered by being informed. 2026 is going to be a year of big savings for some and big surprises for others. Which one will you be? You have to choose to be the master of your own money. You can do this. You are strong, you are smart, and you deserve a retirement where you aren't choosing between your pills and your groceries. Now, go get to work and check those plans.